Let's talk about the types of providers that will care for you during your pregnancy, labor, delivery, and postpartum period. There are generally two types of providers. One is an OBGYN, and that stands for an obstetrician gynecologist. They are medical doctors or doctors of osteopathy. So they'll either have an MD or a DO behind their name. And they generally do births in the hospital. There have been some that do home births. Pretty much most of those do the births in the hospital. So these providers are also trained surgeons. They provide your care all throughout your pregnancy. They will do the delivery there at the hospital and provide your care for you, I think, up until 6 weeks postpartum. It's important to know that each doctor and practice does it a little bit differently. You may actually have one doctor that you see in a practice of many, or you may have a doctor who's in private practice. And depending on their call schedule and how they work it out, sometimes you might actually have a different doctor for delivery. So make sure that's a question you speak to them about when you're going through your prenatal visits or when you're deciding who to get your care from. So I know many practices have like 3 to 5 to 6 doctors, maybe even more. And you see your main doctor, then you might see a few others during your pregnancy, but you'll have the doctor on call during your labor. Others, you will see your one provider through the whole practice or through the whole pregnancy, and then they might be the one delivering you. And so it just varies from one place to the next. So make sure you have that conversation. Now, providers, for the most part, these doctors, they've been trained in the medical model of care as far as pregnancy goes. And so they're trained extensively in the things that can go wrong with pregnancy and medically managing your pregnancy and birth. There are a lot of those doctors, though, that do practice physiological birth. And physiological birth means that basically they're just kind of letting your body do its thing, and they're there to support you or help you if you need it. All right. And so that's OBGYNs. And then now we have midwives also. Now, midwives can be trained like certified nurse midwives. That means they were a registered nurse first, then they went on for their master's or doctorate, and now they are a midwife, a certified nurse midwife. They practice in either the hospital or the home, and there are very few who can actually deliver you at either place. All right. It depends on your state, your county, depends on a lot of things. Now, there are also a lot of midwifery practices that are connected to OB practices. And that's kind of great because if you're seeing a midwife for a low risk pregnancy and then something goes a little awry, say you get gestational diabetes, but it's still well controlled, you can likely still be seen by your midwife, but the OB will kind of be overseeing just in case anything does go wrong. So certified midwives are midwives who go through the training as well. It's just that their initial degree wasn't in nursing. Okay. So they still have a lot of training. And then there are lay midwives and certified professional midwives. Now, the certified professional midwives, they have a different certifying body. They do births in the home, usually, sometimes birth centers. And then lay midwives have training, like hands-on training and apprenticeship type training. There are some of those that vary. And so it's important to know what is legal in your state as far as midwifery care and what do you feel the most comfortable with as far as somebody providing care for you. Okay. Now, some of those midwives do prenatal care and care for you all through the pregnancy and postpartum and, typical gynecological care like pap smears and whatnot. So the difference about midwives, and I'm going to speak certified nurse midwives right now, just because those are the majority. So make sure you check into that stuff if you're looking for somebody other than a certified nurse midwife. But as far as certified nurse midwives go, I've worked with a ton. I've worked with them in home birth and I've worked with them in the hospital. And I personally love certified nurse midwives because of their approach to birth. Their approach to birth is physiological birth. And it's fascinating because it's so cool to see women be supported during the birthing process as though everything's normal and natural. And we're just here with you. The withness of it all is so awesome. And in the hospital, one of the nice things about having a midwife there is they actually will be laboring with you a lot if they're able to, as far as their patient load. And then if you start pushing, they're right there with you during the pushing phases, where a provider, an OBGYN, usually doesn't have the ability to be with you while you're pushing. Your nurse is the main one there with you while you're pushing. They come right when you're getting ready to deliver, where a midwife is there with you through much more of the birthing experience. So if you want a provider who's going to be with you through more of the birthing experience, it's definitely recommended to get a nurse midwife, a certified nurse midwife. And one of the awesome things about this is, like, in the hospital, when you have a certified nurse midwife, there's always OBs around that can help if there's something that rises. And they collaborate with them all the time. At one of the places I worked, it was fabulous because, like, say for instance, your labor wasn't progressing, or there's some reason that you needed to have a C-section. So what would happen is the OB provider would come in and they would do the C-section, but the midwife is there helping them do the C-section. So they're still there with your birth. They're just doing a different job during your birth. They're assisting the surgeon. Generally speaking, it depends on what kind of birth experience you want. If you want a birth experience where you're well supported and things are looked at as normal and natural, and you just want that support if you need it, I definitely recommend a certified nurse midwife. If you want more of a medical model of care, meaning you want them to be there just in case something goes wrong, and you're really nervous about that, then it's probably best for you to get an OBGYN. Now, know that just because they have one title doesn't mean they practice in that model. I know a lot of OBGYNs who really practice the physiological birth practice, and it's fabulous. And I know a lot of midwives who are what we call midwives, meaning they treat it more like a medical situation, right? And so just because they have one title or the other doesn't mean they practice that way, which is one of the reasons asking different questions early on in your pregnancy is important, because it's really hard to change providers later on in your pregnancy if you find out they're not willing to support the type of birth that you want. And so asking those questions like, do you support the use of a doula? Do you limit the hours I can be in labor? Like all these different questions that we have below. It's important to ask those earlier on in your labor and get a really good foundation of a relationship with your provider, whether it's an OBGYN or a midwife.